Hello everyone, hope all of you are doing great. This is DEEPA, faculty in Shankaran IAS Study Circle, Hyderabad. I'll be explaining in this video about the programs under Ministry of Health and Family Welfare. Schemes are very important for prelims as well as mains examination. So one has to study the points which are related to a particular mission or particular program, scheme or the projects of government implemented policies, everything that has to be dealt with in the prelims point wise, and for mains also very important because previous year question papers FEC minimum 10, maximum 20 questions or more than 20 questions it will be there, 22 to 30 questions you can expect. So we don't know luck how it plays. If you know the programs, the schemes of the government, you will be lucky enough to get more marks. So don't depend upon the luck, depend only upon your intellectual skills. Let's start with the programs or the schemes. I'll explain you about the schemes. Under Ministry of Health and Family Welfare, the first program is, first mission, which is I'm going to explain as National Health Mission. Under this, actually, there are many things which are covered, such as communicable diseases, non-communicable diseases, injuries, and newly emerging diseases. Such kinds of things is covered, and as well as the birth rates and anemia, women. All those points are there. I'll explain you one by one. The broad objectives of National Health Mission includes the following: reduce MMR to 1 per 1000 live births, reduce IMR to 25 per 1000 live births, reduce TFR to 2.1. This is the actually objective. This is the goal that they have fixed. Prevention and reduction of anemia in women aged between 15 years to 49 years. So this is the age group where women require a lot of energy. So the women who is actually facing the anemia, they will be actually supported or they will be giving proper medical care under this mission. It prevents and reduces mortality and morbidity from communicable diseases, non-communicable diseases, injuries and emerging diseases. Reduce household out-of-pocket expenditure and total healthcare expenditure. You know that because the government is providing the fund, so it is out-of-pocket expenditure. Okay. Reduce annual incidence and mortality from tuberculosis by off. Reduce annual incidence and mortality from tuberculosis, and reduce prevalence of leprosy 1 per 10,000 population and incidence to 0 in all the districts. All districts, it's important. I told you in the previous year videos as well. All, none, some. These are all the points which are very, very important. These words gives a lot of weightage in options and selecting the options. Word by word, you have to read the options, then you have to mark the correct answers. Before that, don't mark the answers. Okay? Annual malaria incidence to be 1 per 1000. These are all the objectives which are mentioned under National Health Mission. Less than 1% microfilaria prevalence in all districts. In all districts. Kala Azar elimination by 2015, 1 case per 10,000 population in all blocks. The mission has 2 submissions such as National Rural Health Mission and National Urban Health Mission. Public health being a state subject. This is important. Public health is state subject. You all know it is there in the schedules, right? States list, central list, concurrent list. So public health comes under state subject. Support is being provided under NHM to the states or union territories for strengthening their healthcare delivery system. National Rural Health Mission. The next program under Ministry of Health and Welfare, Family Welfare. So that is National Rural Health Mission. It provided reproductive, maternal, newborn, child and health and adolescent services to the rural. This is important. Rural deprived people through its network of ASHA, accredited social health worker, and ANMs and AWWs. It focuses on, the point is very sure, like, sometimes the abbreviations or sometimes the short forms are very important. ASHA, USHA, Nidhi. So such kinds of things are very important. They won't give it in an elaborate form. You should be in a position to know what the expansion or what is the full form for that. Okay. It focuses on providing fully functional, community-owned and decentralized health delivery system in rural areas. NRHM, also called NRHM, RCH, FlexiFull, is one of the components of NHM and is for all towns. Is for all towns, villages below the population of 50,000. This is important. For all the towns and villages below the population of 50,000. Various initiatives under NRHM. I told you, right? ASHA, this is ASHA. Accredited social health activists. Janani Suraksha Yojana, Janani Shishu Suraksha Karyakram. These are all the schemes actually which is coming under, taken the initiatives under this particular mission. Shall we go to the next one? As I told you, ASHA, ANM and AWW, I will be explaining what are all those. Accredited social health activist is a trained female community health activist who act as interference between the community and the public health system. These are the people who will be working in between the public health system and the public. Okay. ASHA must be women. This is very important. ASHA must be women. She should be the women resident of village who is literate with the formal education up to class 8. With the formal education up to class 8 and preferably in the age group of 25 to 45 years. Axillary nurse midwife, this ANM. Axillary nurse midwife is a resource person for ASHA and provides on-job training and guidance and ensures that ASHA gets the compensation for the performance. Okay. So, ANM, Axillary nurse midwife, will support or will be a resource person to ASHA. So, one is related to the other one. Okay. Anganwadi workers, that is AWW. Anganwadi workers guides ASHA in performing activities such as organizing health day in Anganwadi centers, and AWW is a depot holder for drug kits and will be issuing it to ASHA. Okay. This is about ASHA, ANM and AWW. So now the doubts are cleared about it. We'll go to the next program, that is Janani Suraksha Yojana. The main objective of Janani Suraksha Yojana is to reduce maternal and infant mortality by promoting institutional delivery among pregnant women by providing conditional cash assistance of 1,400 rupees. Okay, there is no bar on age of mother. This is interesting. There is no bar on age of mother, number of children or type of institution, that is the government or accredited private health facility. Government, this point is important. Okay, there is no bar on the age of mother, number of children or type of institutions. Okay. The next point, financial assistance under Janani Suraksha Yojana is available to all pregnant women in states that have low institutional delivery rates. Here, all important, all pregnant women will get it. Other than there will be kind of groups there will be there, the castes or backward class or BPL. There is nothing like that. All women who are pregnant comes under this scheme. Namely, Uttar Pradesh, Uttarakhand, Bihar, Jharkhand, MP, Chhattisgarh, Assam, Odisha and Jammu and Kashmir as well. So these are all the states under which the program is implemented. They are categorized as low performing states in high performing states where the levels of institutional delivery are satisfactory. Pregnant women from BPL, SC/ST households only are entitled to JSY benefit. I told you this one for only these states which I have mentioned in the above point, only for those cities, those states. Other than those states, they are actually only from the background of BPL, SCs and STs. Hope the point is clear. The scheme also provides performance-based incentives to ASHA. If they do the best work, they'll get the right incentives for the work that they have done. So the next program is Janani Shishu Suraksha Karyakram. All this actually, it is very much sure that Janani means usually pregnant women or the birth of the child. So such kinds of things will be related. But you should be very careful in selecting the options because so many programs are there relating to this Jananis. So that is the reason why you should know the difference between what is the difference between this program and that program. Understand? The points which comes under this particular schemes are, the scheme is entitled all pregnant women delivering in public health institutions and absolutely free and no expense delivery including C-section. Not only normal, including C-section, they will bear all the expenses. All the expenses are borne by the government. A pregnant woman is also entitled for free transport from home to the government health facility. The ambulance facilities will be provided free of cost. There is not even a single rupee that they have to pay for that. Entitlements include free drugs, consumables, free diagnostics, free blood, free diet up to 3 days for normal delivery, 7 days for the C-section, 3 days for normal delivery and 7 days for the C-section. Okay. Similar entitlements have been put in place for all sick newborns accessing public health institutions for health care till 30 days. If at all they have born with the sickness, they will be providing all the health requirements or the facilities within 30 days. 30 days they'll take care and they'll make sure that the baby is fine. Once the baby is fine, they'll send back to their homes. Okay. It also provides for free transport from home to institution between facilities in case of a referral and drop back home. I told you before, the ambulance facilities and everything will be provided free of cost. This initiative will also help in reducing maternal and infant mortality and morbidity. Rashtriya Bal Swasthya Karyakram. Rashtriya Bal Swasthya Karyakram, it is actually envisages child health screening and early intervention services, and it subsumes the existing school health program. I told you before, old wine in the new bottle. In the same way, there are schemes which will be subsumed or which will be given a new name, or sometimes it so happens that the same program, the scheme will be there, the facilities and everything will be same, but they will provide a new name. So what is that exactly? Whether it is changed or not, let's see further. The scheme aims at every identification and early intervention for child or the child from birth to 18 years to cover 4 Ds. You are very much familiar with 4Ds, I suppose, because this was there from long time. Defects at birth, deficiencies, diseases, development delays. These are called as 4Ds, including disability. The 0 to 6 years of age group will be specifically managed at district early intervention center. 0 to 6 years will be managed by districts. Okay? Whereas 16 to 18 years group will be managed by public health facilities. That is the difference. Understand? DEIC will act as referral linkages for both age groups. Children under 6 years will be screened by mobile block health teams at the Anganwadi center, and those between the age group of 6 to 18 years will be screened at the local schools at least once a year in the government and government aided schools. These are all the points comes under Rashtriya Bal Swasthya Karikram. The main thing is Bal means what? The strength. The strength remains where? The strength will be there with the children of that particular, the youths. So that is the reason why the government is concentrating more on that particular age group. So it should be in a position to understand and correlate the terms that are used in the scheme's name. Okay? Shall we go to the next thing? That is Rashtriya Krishi Swasthya Karikram. What is it saying all about? It is a health program for adolescents. Adolescents means 10 years to 19 years. You all know it. Universal coverage. Key principles are adolescent participation and leadership, equity and inclusion, gender equity, and strategic partnerships with other sectors and stakeholders. What are all the focus areas? To improve the nutrition, improve the sexual and reproductive health, enhance mental health, prevent injuries and violence, prevent substances misuse, and address non-communicable diseases such as hypertension, stroke, cardiac vascular diseases, and diabetes. These days you can find diabetes. So to control that or not to get that, such kinds of informations will be provided for the group of 10 to 19 years of age. So that is about Rashtriya Kishore Swasthya. Swasthya means health. It's very much clear in that statement itself, or the name of the scheme itself. Swasthya means what? Swasthya means health care taken by the government under this program for the age group of 10 to 19 years. National Urban Health Mission. National Urban Health Mission to meet healthcare needs of the urban population with the focus of urban poor. To meet the healthcare needs of the urban population. Urban. Can you find that one? The similarities? Easy. But be very careful. Urban poor, slum dwellers also included, by making available them to the essential primary healthcare services and reducing their out-of-pocket expenses for treatment. Not only the poor, but also the slum dwellers will be included under this program or the scheme. It seeks to strengthen the existing healthcare service delivery system, converging with the various schemes implemented by Ministries of Urban Development, Housing and Urban Poverty Alleviation, Human Resource Development, and Women and Child Development. So, each and every ministries are correlated with each other to help and make the program successful and a national urban mission. So this is about National Urban Health Mission. See, it works in partnership with the community and local bodies and NGOs, and District Health Action Plan is prepared. NUHM would cover all state capitals, districts, headquarters, cities or towns with a population of more than 50,000. Here the word all is very important. I explained you before. Center state funding pattern will be 75 to 25. 75 is to 25 for the states and 90 is to 20 for special category states, okay, such as northeastern states. The next program, Pradhana Mantri Swasthya Suraksha Yojana. Pradhana Mantri Swasthya Suraksha Yojana. The scheme aims to correct regional imbalance in the availability of affordable, reliable, tertiary healthcare services and also to augment facilities for quality medical education in the country. There are two components which comes under this. What are those two components? The first one is setting up of aims like institutions. The second one is upgradation of the government medical college institutions. That relates to Pradhana Mantri Swasthya Suraksha Yojana. The next one, Rashtriya Swasthya Bima Yojana. What is the main objective of this scheme? To provide financial protection against catastrophic health cost. What is that? Catastrophic health costs. Improve access to quality health care for below poverty line BPL households and other vulnerable age groups. In the unorganized sector is important. Unorganized sector. So here one point, that is catastrophic health care costs. The second one is unorganized sector and BPL. Important. Okay. Under Rashtriya Swasthya Bima Yojana. It is a centrally sponsored scheme. It is centrally sponsored scheme. Health insurance scheme designed to target below poverty line. So this is completely central sponsored scheme. Okay. So households and unorganized workers like covering the construction workers, street vendors, etc. So all this comes under this particular Yojana. The premium cost is shared by center and the state. The premium cost which requires for the particular scheme will be covered by or shared by state and center both. The beneficiaries are entitled to hospitalization coverage up to 30,000 rupees per annum on family floater basis, that is can be utilized by any family member. This is also important. They may give only head of the family. Sometimes they may give it as only head of the family. Any family member. It can be given to any family member. That is the reason why I say read word by word. Each word is important. The coverage extends to maximum 5 members. Maximum how many members? 5 members. Up to 3 dependents, including the provision to pay the transport expenses. The beneficiaries need to pay only rupees 30 as registration fees for a year. Premium will be paid by the government. The registration fees of rupees 30 rupees has to be paid by the beneficiary. So, beneficiaries get a biometric enabled smart card. There will be a smart card which they can use it when it is required, containing their fingerprints and photographs as it is there in the Aadhaar. Okay, and this single central smart card is also to include other welfare schemes like Aam Aadmi Bima Yojana and National Old Age Pension Scheme. Earlier, this scheme was under the Ministry of Labour and Employment. This is a very, very important point because this was under Ministry of Labour and Employment. Now, it shifted to the separate ministry. So, the differences you should understand. Which ministry was there and how, now under which ministry, the name of that particular scheme. What was it? Now what is it? What are the changes that has been done? Upgradation has done. So, those are all the points that you have to keep it inside your mind when you're reading about the schemes. The next program under this ministry is Rashtriya Arogya Nidhi, RAN. It aims to provide financial assistance to BPL patients Who? Only the BPL patients who are suffering from major life-threatening diseases. That should be major. It's not minor. Make sure, my dear friends, it's not minor, it is major. So such kinds of points are very important. Such as to receive the medicines at any of the 13 listed super specialty institutes or government hospitals. So 13 number is important. Only 13 listed super specialty institutes, that may be private also, and government hospitals. The central government or state government or PSU employees are not eligible. This is important. The government employees are not going to come under this. Obviously, when it is considered with BPL, then how can they come? They won't come under that. The next point is the financial assistance to such patients is provided in the form of one-time grant. Important. It is one-time grant which is released to medical superintendent of the hospital in which the treatment has been received. So it is a one-time grant. The states are needed to create their own state illness assistance funds. They have to create their own funds in which central government contribute 50% of the fund, and the fund is granted to medical superintendent for the treatment. In the same way, the state government can grant up to 1.5 lakhs in each individual case in their state and forward the cases that exceed rupees 1.5 lakh to RAN headquarters. A revolving fund has been set up in 13 central government hospitals or institutes. These hospitals can sanction financial assistance up to 5 lakhs, but beyond rupees 5 lakhs, it has to be referred to RAN headquarters. So this is about Rashtriya Arogya Nidhi. Okay, Nidhi means the fund, which is actually stored or kept for the use of the required person. Mission Indradhanush. There are two Indradhanushs. Don't get confused with it. One comes under Health and Welfare Ministry, the other comes under banking sector. Mission Indradhanush, it is also there in the banking sector. This Indradhanush, it is about the vaccination. What are all the important points that you have to know under this Mission Indradhanush are: mission aims to cover all those children by 2020. This is the target year, who are either unvaccinated or are partially vaccinated against 7 vaccine preventable diseases. What are those 7 diseases? That is important. Diphtheria, whooping cough, tetanus, polio, tuberculosis, measles and hepatitis B. 7 is done. So the first one is diphtheria, whooping cough, tetanus, polio, tuberculosis, measles and hepatitis B. So it aims to fully immunize children under the age of 2 years and pregnant women with all available vaccines. The mission is being implemented in 201 high focus districts in the country in the first phase, which has nearly 50% of all unvaccinated or partially vaccinated children. The campaign is a part of Universal Immunization Program by 2020. I told you before itself about that. So the ministry will be technically supported by World Health Organization, UNICEF, Rotary International and other donor partner. So this is about Mission Indradhanush. The next one is Mission Parivar Vikas. What is Mission Parivar Vikas? Mission Parivar. Parivar means family. So let's see what is going to explain about. The mission was launched on the occasion of World Population Day. This was introduced on the occasion of World Population Day. The aim of the mission is to accelerate the access to high quality family planning. This is related to family planning. I told you Parivar. Parivar means family. So family Vikas. The mission focuses on family planning initiatives and targeted approaches for population stabilization through better services delivery approach. It will focus on 146 high fertility districts, 7 states with total fertility rate. There are states which has been recognized where the fertility rate is high. So those states and those particular districts will be covered under this mission Parivar Vikas. A program named Antara was launched under this mission. Under this program, a new injection will be used which will act as an alternative to the current birth control. How to remember and how to connect it? Antara means what? The difference or the time gap, the gap, right? So the gap between the births, right? So that is related to mission Parivar Vikas. Under that one, the injection which is given, that is important. Okay, that's done. The next one is Project Sunrise. Project Sunrise, it is a new hope or the sunrise, the new sunrise relating to HIV patients or people who are actually facing the initial this thing actually relating to this HIVs. Okay, the project is to tackle the increasing prevalence in the northeastern state. This is important, especially in the northeastern states. It aims to diagnose 90% of such drug addicts with HIV and put them under treatment by 2020. Even this is also having the target here as 2020. It will cover 1 lakh people living with HIV or AIDS by giving them treatment and care facilities free of cost. So it will be implemented in addition to the existing project. This is implemented with this National AIDS Control Organization, that is NACO. So with this actually that will be providing or that will be supporting with it. The project has been sponsored by US-based Center for Disease Control and would be implemented by Family Health International 360. Okay. The next program under this is National Deworming Mission. National Deworming Mission, it is actually for the age group of 1 to 19 years. From the intestinal worms, that is helminths. Okay. According to WHO, India has the highest burden of soil transmitted helminths in the world. Very interesting and very important. Albendazole tablets will be given to all targeted children through Anganwadi centers and schools. National Deworming Day is observed on 10th February. So that's important. National Deworming Day, it's celebrated on 10th February. Pradhan Mantri Suraksha Matritva Abhiyan. The program aims to provide assured, comprehensive and quality antenatal care free of cost universally to all pregnant women. All on the 9th of every month. The date 9th of every month for all pregnant women. It guarantees a minimum package of an antenatal care services to women in their 2nd or 3rd trimester of pregnancy at designated government health facilities. So the health checkup includes a minimum package of parental care and antenatal care services, that is a care given during the pregnancy, and medicines such as IFA supplements, calcium supplements, etc. would be provided. So the program follows a systematic approach for engagement with private sector. It also laid a special emphasis on early diagnosis, adequate and appropriate management of women with malnutrition and adolescent and early pregnancies, as these pregnancies need extra and specialized care. So that the aim to improve, what is the aim of this scheme? The aim of the scheme is to improve the quality and coverage of attendal care, including diagnostic and counseling services as part of the reproductive, maternal, neonatal, child and adolescent health strategies. So that is related to Pradhan Mantri Surakshit Matritva Abhiyan. The next one is National Health Protection Scheme. What is this National Health Protection Scheme is all about? Let's have a look into that. National Health Protection Scheme is an insurance policy. It is an insurance policy under which poor people can get life insurance coverage up to 1 lakh. The main aim of the scheme is to provide financial assistance to those families who have lost their earning member, the head of the family, if he died, accidental or natural, both. Don't think that it's only for the accidental. Sometimes they may ask only for accidental. Here you can see both are there, accidental as well as natural. Accidents or natural calamities. Also, the insurance scheme aims to protect the person from health diseases and other long-term health issues due to any accidents. Beneficiaries are people below poverty line. This is actually for those who are coming under BPL. Okay? Economically weaker section and people who are listed under the deprivations according to the socio-economic caste census of India. Caste census, you should have the idea about it. That has done how they do it and what basis. All those points are very important, my dear friends. So please look into that. For senior citizens of the age group of 60 years and above belonging and above mentioned category, an additional top-up package of 30,000 will be provided. Universal Immunization Program, that is UIP basket, as vaccines for 10 diseases, that is BCG, TB, OPV for poliomyelitis, measles, vaccines for measles, rotavirus vaccine for diarrhea, JEV vaccines for Japanese encephalitis, and the kind of vaccines for particular diseases. Those are included under this particular program. So the next one is measles rubella vaccines is added now to the UIP. This is okay, not that much important, but you should know the second point, which is very important because this is newly added to the UIP. For this program, measles rubella vaccines is newly added. That is the very important point that you should understand. India has set a target of eliminating measles and controlling congenital rubella syndrome caused by rubella virus by 2020. Most of the schemes are actually having the target date 2020. So, Vatsalya Matritva, Amrit Kosh Vatsalya and Matri Amrit Kosh is a National Human Milk Bank and Lactating Council centers at Delhi. This is important. The centers and the places where they belong, it is very important. Okay. The next one, it is opened in collaboration with Norwegian government, Oslo University and NIPI Newborn Project. This is relating to Norway. The technology has been borrowed by Norwegian government. It will collect, pasteurize, test and safely store the milk that has been donated by the lactating mothers and make it available for the infants in need. It is also acts as teaching, training and demonstration sites for other milk banks. That is about Universal Immunization Program. The next one is mother's absolute affection. That is Ma. M-A-A. What is it called as? Ma. Mother's absolute affection program. The program aims to enhance optical breastfeeding practices in the country. It seeks to create an enabling environment to ensure that mothers, husbands and families receives adequate information and support for promoting breastfeeding. You all know how much it is important, how much proteins and everything it will be carrying by the mother milk. So the importance has to be told to the mother and the family members. That is the main aim of Ma program. Okay. The chief components of the program are community awareness generation, strengthening interpersonal communication through ASHA, skill support for breastfeeding or to delivery points in public health facilities, and monitoring or award recognition. So the award also will be given if they support this program. So my dear friends, this is about the schemes under Ministry of Health and Family Welfare. I think you're all doing great. Do the work. The work will never makes you fail. You will get success. All the very best. Hope you see me in the next video. Thank you.